today we have remarkable speakers that I found. We have five speakers. I will introduce to you one by one. So the first one is Ibu Dr. Melia Naratana Pugu. Hi, Ibu Meli. How
Hello.
are you?
Hello, I'm good. Thank you. Hello,
Yeah.
everyone.
Bu Meliana, as a Papuan woman, she came from Papua. She is a lecturer of international relation in Universitas Cendrawasih, Papua, Indonesia. Thank you for coming today, Ibu Meli.
Yeah.
And then the second one is Ibu Winnie Yi or Madam Winnie Yi. Hello, Winnie, Madam Winnie, Ibu Winnie. And then Bu Winnie is a President Sabah Women Action Resource Group. And then we also have Dr. Ampon Maden. Yeah, Dr. Ampon is a founding members of the Centers of Excellence on Women and Social Security and head of the research department of the School of Language and General Education in Walaila University, Thailand. Dr. Ampon has spent time partnering with NGOs and GSO to discover the way to advance peace and social justice. So she's very active. She is recently appointed by Ministry of Foreign Affairs of Thailand to be the member of ASEAN Women Peace Registry, a group of women experts representing their country to promote women, peace, and security in ASEAN. And Dr. Ampon also has read a very important paper with regard to her expertise. And we also have Madam Siti Rajabia Monato. I hope that I called you right, yeah, Madam Siti. So Madam Siti is currently served as the gender analysis of the United Nations Population Fund and a GBV subcluster coordination in Mindanao. She has 17 years of experiences on human rights, paralegal, child protection, particularly on child association with armed force and group. So, and gender equality, gender-based violations in both development and humanitarian setting. So she was deployed in various disaster and humanitarian crises, providing immediately life-saving intervention, including the provision of psychosocial support. Wow, this is very important. I'm impressed. Yeah, Siti is graduate of mass communication and finished her Juris Doctor degree from Notre Dame University. Uh, Thank you, Bu Siti, for coming today. And then the fifth one is Madam Vanessa Fianca Palarco. Yeah. Madam Vanessa is the Director of Social Healing and Peacebuilding Department and Team Leader, Management Team of the National Incident Emergency Operations Center, Office of the Presidential Advisor on the Peace Process, Philippines. I'm really impressed. So I will be joined with a very strong women and very remarkable women today. So we are so lucky participant, and then we hope that we can enjoy our session. But before that, I want to inform you for the participants. So because we do daring, sometimes we need to make sure that we need to off the mic. And then if you have any question, you can raise hand, or you can also utilize the chat room during the speakers presenting their paper or their ideas, okay? And then for the speakers, we only have about 5 to 8 minutes for each of you. So I hope that you can manage the time. And then for today, and now I will give the first opportunity to speak to Ibu Meli. Bu Meli, the time is yours. The topic of Ibu Meli is how women cope with the pandemic in West Papua.
Okay. Thank you. Thank you. But I will start to share my screen, but oh wait. I cannot start screen share while the other participant is sharing.
Oh, okay. So perhaps the host can assist, yeah, to turn off the slide so that Ibu Meli can start, or the participant is operating it. Yeah, okay. So the time is yours, Bu Meli.
Okay. Actually, I have a several slides, yeah, for
Yeah.
us. Well, yeah, this one. Okay, okay. That by and all of the, yeah, okay. Um, Good afternoon, everyone. My name is Meliana Pugu. I'm a lecturer in Cendrawasih University for Department of International Relations. Thank you for having me. And today I'm going to present about how women cope with pandemic in West Papua. Um, First, I'm going to talk about women and pandemic in Papua. As we know, women and pandemic it's in Papua. Uh, it's hard for women to handle pandemic. Uh, why? Because there are different factors that cause this, such as first one is Papuan women are women who live with strong norms and custom, and the second one, Papuan women are usually the backbone of the family, and the third, Papuan women in the grassroots class tend to be poor, and the last one, Papuan women have a low level of education. And on the other hand, Papua is one of the province in the eastern tip of Indonesia with 3 million and more population, is currently the province with the lowest human development index of, it's about 60.84 in 2019 compared to the national IPM of Indonesia IPM, it's about 71.92. And next, we can see the norms and custom in Papua. When we talk about the Papua, the majority of the population in Papua is the Melanesian that live in 29 districts or cities, including Merauke, Jayawijaya, Jayapura, Nabire, Yapen Island, and until in Jayapura City. There are 29 districts, and they are divided into 5 different tribes, such as Mamta, Tabi, Taireri, Lapago, Mepago, and Haanim. Each tribe has their own language. And when we talk about norm and custom in Papua, with strong norms and custom, it has an influence during the COVID-19 pandemic. Among other things, there is a habit of celebrating weddings by gathering many families to collect treasure that will be delivered to the bride to be. This get together is still done in the pandemic period. This makes it difficult for women because they also have to get to cook and eat together, which put their health at risk during this pandemic. And in this slide, I'm going to talk about how women plays the role for supporting the basic needs for family. And Papua women is in lower class are usually or tend to be women who work for their families, meaning they act as the head family. Their job is to grow and sell the crops to the market in order to get money. In addition, when women are selling their crops, they are interacting with different customers. They need to take public transportation to the market too, so they are more likely being exposed to the virus, and they do not know if the customer is either negative or positive COVID. What about poverty and pandemic in Papua? Even though Papua has abundance of natural resources, the people are still live in poverty. Poverty is also driving factor for Papuan women during the COVID-19 pandemic. Why? because with poverty, the level of education is low, also the quality of housing is bad, and also sanitation and health infrastructure and the economic is decreasing, which causes the susceptible Papuan women in the pandemic period. So how to deal with the pandemic as the topic I will talk today. In my observation in Jayapura city, Papuan women are divided into two groups, such as obedient group and those who are disobedient. The care group are those that obey the rules and understand the dangers of COVID-19, while the other group are those who do not know, pay attention to the rules, and ignore the dangers of pandemics. Based on the two groups, it appears that the obedient groups will always keep a social distance, wear masks, wash their hands regularly, eat nutrition food, exercise regularly, drink enough vitamins, and get enough rest. So, on the other hand, the disobedience, the second groups do not wear masks, do not keep their distance, do not wash their hands, and why does this happen? Because these women have to work hard to support their family's need because of economic needs. Without working, they cannot eat and meet their family needs. So what is the effort that can be made for Papuan women in the pandemic? Um, that Papuan government have an interface to Papuan women working in the microeconomic sector. BPS data, statistic official data from BPS in 2019 show that the number of Papuan female workers is almost the same or even higher the number of men in some regions, such as in the Dayai Regency, the number of men working is about 90, 91.70%, and women is about 92.65%. And can we see in the slide? The percentage figure for us show how much women are working in the family life in Papua. And the help or support from parties to donate masks, hand sanitizer, or hand washing places in public places, especially near markets where Papuan women working, is also to help with food during this pandemic to reduce the economic burden on women. The simplest effort that can be done to face COVID-19 in a family in Papua environment is to run a health protocol well. This will be difficult to do in middle and lower economic class in Papua province because they do not have enough income for supply like mask, hand sanitizer, and vitamins. And other efforts to deal with COVID-19 in the community are to avoid crowds, establish health protocols, and keep your distance, wear masks, wash your hands, and continue to socialize and be an example to others about the importance of running health protocol in this pandemic. This is Papua data about patient based on 3rd October 2020. We can see that in the city of Jayapura, which was hit by COVID-19, the patient is about 3,307 2007, and 58 people die. And the cumulative totality of patients in Papua with a positive COVID, it's about 6,736 people. And this picture were taken this morning, it showed that it's like nothing changed in this pandemic in Papua, especially in Kota Jayapura. We can see together Papuan woman and market today, 7 October. Uh, uh, Papuan woman and market, and this is like this nothing happened. It's not in the pandemic. Yeah, you can see that they not use mask. They just sell their product as usual. That's not new normal or something. Yeah, this one also. Mhm. Okay, and yep, it's a that photo I took this morning. Yeah, but you can see that.
Okay.
Yeah,
Yeah, that's true.
it's not the normal actually
Yeah.
in Papua. Yeah, it's just like the day without pandemic. Okay, thank you. I
Thank
think
you.
that's it. Yeah.
Yeah, thank you, Bu Meli. It's
Yeah.
very interesting, yeah, because in many area, COVID actually has, provide a change in the
Yeah.
way of the people life. Yeah, but in here, as Ibu Meli has mentioned, there are two categories of people over there, which is obedience. And then also disobedient, it looks like they don't really see it as a situation that need to be respond. Yeah, it's just like human activities as daily life activities. That's interesting. But I just want to ask you one more questions to you before we move to the different speaker.
Okay.
So do you think that because we know that Papua has a lot of problematic situation that you mentioned before is about the poor and then the lower education, whether the because of the issue of education, whether the school is still open over there or it is operated as usual, or what do you see?
Ah, it seems like other region in Indonesia that the school is that they study from home.
Okay.
But the problem is the internet connection. Yeah,
I can see
it's
that.
just
Yeah.
just only student in Jaipura city can use their internet,
Okay.
but in other place in Papua, 28 district or 28 regency cannot have a internet connection, and that's not good
Okay.
for our
One
generation.
more question, Bu
Yeah.
Meli. Because in other region of Indonesia, we found that there are the rise of violence against women. Whether it is also happen in your particular area, the raise number, the case of
Okay.
domestic violence or violence against women, are there still happen or it is stopped because of the COVID?
Okay. Actually, I have no formal data about that, but when I'm going to uh, justice office, what is it?
Yeah,
Yeah,
the
and I
justice of.
see the data in their form. There are a lot of couple want to divorce, and I think that's a problem
Okay.
because because in pandemic uh, time it's maybe there are because of poverty in Papua because woman
The
is
conflict in family race, yeah,
conflict
okay, it become a
domestic area.
domestic areas. Okay,
Uh-huh.
thank you, Bu Meli. And
You're welcome,
then,
Bailey.
yeah, I think I want to join. I want to invite directly Ibu Winnie Yi or Madam Winnie Yi. So, Madam Winnie Yi will discuss about the preventing gender-based violence in the time of COVID-19. Yeah. Time is yours, Mbak Winnie or Kakak Winnie. Uh, Please.
Thank you, Dr. Sri, or what, Evie, you say? Is
Yeah,
it Evie?
yes,
Evie,
yes.
so cute. Okay,
Yeah.
thank you.
Orang Inggris.
Good afternoon, everyone. I hope you can hear me loud and clear from the
Yes.
Kota Kinabalu in the island of
Aku
Borneo.
Indonesia. Aku
Very,
nih.
yes, very close to Philippines and Indonesia. Yeah. Um, I am, first of all, I need to thank the organizers, and I must say I am really feeling very, very privileged to be with all these wonderful women. Yeah, Ibu Sri was talking about their background. I actually felt like I should just switch off and run away because compared to the work that you guys are doing on the peacekeeping and international arena, um, it makes me feel like the work we do on the ground, in villages, in the districts, in Sabah is like on another planet. But I think that is also a positive thing. That means I can have something to share. Ibu Sri was saying. So, okay, without further ado, I just thank you so much for giving me the opportunity to share what Sawo. Actually, our group is called Sawo. That's our nickname, just like Ibu E. We are called Sawo, and I think Indonesia and Philippine language can also understand that. It means my other half. You know, it's either my husband, my wife, or my intimate partner. So in Sawo is actually a very, very volunteer-driven group that was started by me and about 10 to 12 young women and men in the mid-80s. Yeah, so that was a long time ago. And it was basically because we were very concerned with the increasing violence and discrimination that we see around us at that time. But I am sad to say that the situation, as far as the prevalence of gender-based violence is concerned in Sabah, I think it seems like it's becoming increasing. We do not have prevalence data, but from our day-to-day work, we can see it going up, especially during the time of pandemic. I think all of you will agree that globally there is a rise for various reasons. There are a few papers and research that have been discussing this. Yeah, so I will not go into that. So I think in the Sabah situation, it is a little bit like what Ibu Meli described for the women in the rural areas. They are still very agro-based, planting their own crops for home consumption, and also working on plantations to earn wages along with their husbands or family members. Yeah, so there is a mix, kind of a transitional subsistence and wage labor going on in the districts. But just to be clear, I'm going to talk more about the areas that Sawo works in, which is basically the interior, more towards the interior areas and the West Coast. I'm afraid to say we do not have a strong presence on the East Coast, where the communities are different and the historical and cultural realities are quite different to the areas that we are familiar with. Yeah, the indigenous people in the interior and the West Coast is what we are more familiar with. So they are agro-based, they are doing micro enterprises, income generation, and so on. So since my topic is to focus on preventing gender-based violence in the time of COVID, I must say, first of all, this is something new for us because we've never been confronted with such a crisis situation. Um, but coming out from the first lockdown, which started in March, I think this, by the way, we have just started our second conditional lockdown in parts of Sabah, and Kota Kinabalu is one of them. So I think we are able to learn lessons that we didn't know during the first lockdown. So we are a little bit more prepared. But generally, I'm sure everybody agrees that, you know, you don't just prevent gender-based violence in the time of COVID. The background, all the work has to be a continuous, you know, initiative or effort, which, well, for Sawa, it started in 85. So even though we have made progress in terms of the law, we have the law, domestic violence law, and we have policy about marital rape and child marriage and child abuse in the home and so on. Most of these legal and policy instruments are more effective in the urban areas and especially in the capital, which is across the South China Sea in Malaya. So being in Sabah and on the tip of Borneo, we are a little bit removed from that situation. So in terms of that kind of progress, we're still not seeing it on the ground. Yeah. So what do we do on the ground? We have to work or build on community resources. Yes. We are very, very encouraged by the experiences we had when we started building context and connection and collaboration with village headmen, village development committees, community leaders from the what we call here is the adat or the mahkamah adat, the native courts, which are a lot more easily accessible to rural communities. Yes, and of course, capacity building for women from the village, empowering them, giving them a sense of confidence, validating their own experience of violence in the sense that it's not their fault. It is a crime. They do not have to live with it. Yeah, it is their right to have access to protection. It is their right to feel safe, to be secure at home, the place. I mean, people say home is where, you know, it's heaven, you know, but for families that are faced with violence, home is hell, right? Right. So we focus more on communities, building communities, neighborhoods. We encourage communities in the rural areas to take it up and have zero tolerance on violence. So together with local based groups, especially faith-based groups, they are such a strong partner because they are in the village, they are in the communities, and they would be the eyes and the ears and the legs and the hands, you know, for whatever we need to do. For example, if there are cases in the village and the community doesn't know what to do with it, then we will network. You know, they will tell us, and then Sawa will contact the nearest agency that can give protection and help to that family, and it's kind of like a triangulated method. Thank God for the handphone. So at least there is this. So I must say that the women and children protection officers in the police force are sympathetic if we ask for help. So I mean, a village really far away can be contacted. Police personnel can be sent to that village or the home if we go through this pathway. But as we all know, during COVID, all the resources will be focused on preventing and fighting the virus. So only serious cases. So we have to say it's very serious. She's dying or she's going to get her hand chopped off. That sort of thing. So that is not really the best solution because as we all know, domestic violence does not start with a huge machete landing on your back. It starts very slowly, emotion, psychological, it's a vicious cycle. And the violence escalate.
Yeah.
Yeah. So am I finishing my time
Yeah.
now, Ibu? I could
Yeah.
I could go on. I could go on and
Alright, I
on.
think,
But just
yeah.
to 1 minute for me
Okay,
to wrap
please.
up. To wrap up. So what we have learned from the first lockdown is we have to use community resources. So we have to collaborate with people who deliver food, deliver essential goods, food packages. I mean, we are thinking about putting messages into these food packages, This is so awesome. In the old days, people put messages in mooncakes, right? So
Exactly.
everything is, but the other thing is we need to find alternative ways to reach women in the rural areas because the digital divide, not everybody has a handphone or is on the computer, but we can do it through the radio. Yes. So we have to put more messages out on the radios in their local language to give them the confidence that you do not have to keep getting violated. There are means to get out of it. Yeah. So the radio is a good one, and I think we have to do that more, right? And to move almost everything online, all our services and activities have to go online. So we do a lot of online webinar or social media campaigns in local language, in easily understood messages so that people can have access to this information. Okay, Ibu Sri, I think a lot more, but I think we can have time for discussion later.
Okay.
Yes,
Thank
thank
you.
you.
Thank
Yeah.
you, Bu Winnie. I think it's very interesting. When we discuss about Papua, it's a big community, but in Indonesia context, it's part of the conflict zone. Yeah. But in Sabah that Bu Winnie has mentioned before, it's more likely have a different kind of perspective of the conflict. This is not conflict zone. This is not conflict area, but there is a conflict in the society that are more individual one. So this is also part of the issue of the conflict for everyday life activities of women. So that's a very interesting. And then Bu Winnie has already mentioned about indicate some situation, for example, like domestic violence. And then Bu Winnie has already mentioned about the initiative that had to be done. Yeah, but important one is about the contact, connection, and collaboration. Yeah, with a village officer, and then also community leader, interfaith group. Yeah, faith community group. Of course, Bu Winnie find out there were a challenge, especially in the COVID, because of everybody focus on preventing COVID, so people cannot sick, people cannot so the case of domestic violence is only can be handled if it is already serious. Yeah, so because of the resources are moved to focus on COVID. Yeah, I think that's very interesting discussion, Bu Winnie. So
Thank you.
now, yeah, I hope that I could summarize quite clear. So now we move to Dr. Ampon Marden. Yeah, Dr. Ampon will discuss about women in Thailand and their initiative. Time is yours, Dr. Ampon. And again, it's about 5 minutes until 8 minutes. Thank you. Dr. Ampon?
Unmute. Okay, I'm now unmute.
Ah, okay. All right.
Sorry.
That's
I
okay.
speak on my own. I'm sorry. Thanks a lot. Thank you, Dr. Srivianti, and our speakers in the beginning of the forum. And thank you for inviting me to join and learn a lot from the women experience in Southeast Asia or in ASEAN. We talk about the security in another form from the experience of women and from the ground, as well as the living experiences. The issues that I can contribute is about how the Thailand, how women in Thailand and the initiative on women, peace and security. We talk about the anniversary of the Agenda 1325. And we talk about how it is impact to the society and how it is affect to women in conflict area and in our countries. So for Thailand, we got a lot of challenging to implement the process of policy on gender equality and women's empowerment by support by the state or international agencies, but we still have hope that during the transition of democracy and the transformation of political situation in the country, especially in Bangkok and in big cities, we can see from the news and from media regarding the call from young or teenagers for more reformation on good governance and how to move forward and how to be involved by people in the society, by the citizens. So this is the background that I think I should start by it before we go to the issue of women peace security. For the women peace security agenda, we know it is the global agenda and it is impact and it is applied as well to different societies. In Thailand, this agenda focuses more specifically in the deep south of the country, where the conflict taking place for more than a decade or about 15 to 16 years. We know that a lot of promotion activities and projects from the bottom, from the ground, from different organizations, even from the state to organize and to provide a big concern on peace building in various perspectives from NGOs, from civil society organization, from women ourselves, and from the state as well. So people who are affected a lot on the violent conflict, it's not only people in the area, but also people in Thailand as well. Once we heard about the news, we watched from the media, we attempt to understand, but at the same time, we were separated in the sense of if this kind of situation doesn't happen in the South, so what will be understanding among people in the society in general about the livelihood or how people live in the area. So once we know in the south of Thailand, the majority of people are the Malay Muslims. The Malay is the ethnicity. So we see that this kind of issues, the issue of religion and the issue of ethnicity always involved in conflict area. When we trace to the agenda, women peace security agenda, we know this kind of agenda address three main areas or three main themes. First is the involvement of women and girls in conflict area, demand the protection from sexual violence or gender-based violence. So this reflects to not only the state agency, but also the community to take responsibility. And we know a lot of community-based group, civil society organization, especially women's group, work hard in this regard. They are very busy to mobilize the groups of people from their own community to work with international NGOs, work with different other NGOs from different region of the country. And some groups work collaboratively with the state. So this kind of first theme that focus mainly on women, peace, security agenda highlight on or asking about the responsibility, the common responsibility from different sectors. The second one, we know that women from the theme of women, peace, security agenda, women must have the role in prevention and resolution of the conflict and peace building. So we also see from the scenario of women in the south of Thailand, not only in the south where the conflict taken place, but also women from different parts of the countries, and especially women groups in Bangkok. Once the political situation in Thailand are more rising by the call from young people, the issue of the South are also increasing of stating, which means that the issue is not only among people in the conflict area discuss find a way out or find the solution, but the issues bring along with this kind of situation, political situation, the involvement of young people, the involvement of the civil societies, the involvement of young generation. So back to the third themes of women peace security agenda, it is focused on local actors, member of the state, and the UN system need to adopt gender perspective in peace operation, negotiation, and agreements. So in the third theme, the situation in Thailand is not that far if we could compare to our neighboring countries, our friends in Indonesia, in the Philippines. We know that the mobilization, the intention, the aims of the state highly impact on the implementation. In Thailand, we have the policy, definitely. We know that the government concerned, at the same time, the government confronts with different problems, different issues, and conflict in the South is always go on every day, every situation always get caught by the media. So when we talk about the third theme, we need the collaboration, which is not only one sector to work. So we need to collaborate the idea. We take into account how far the state could support organizations, women's group, young people, and how they could collaborate. Not only support, but we need to collaboratively working with people who already work on the ground very strongly. So with this issue, with this scenario, we can see that different organizations in the South, women group, more than three who are active work on how to stop torture, how to make peace building, how to discuss and talk about the participation of women in track 1, track 2, and not only in track 3, how we can get involved, not only voice from outside. So this kind of issue discussed in daily life among the groups of people active in civil society organization. But when we look back to people in general, the citizens in conflict area and out of the conflict area, the issue is not only how we could make the dialogue, how we could apply the peace building process from such kind of structure, but how we could live together, even we have different ideas from political ideology, from different ethnicity, and from different belief system. So this is one of the issue that we, when I say we, it means that not only the lecturer, the scholars, but also the government as well has to take into consideration how far we could collaborate. And it is difficult to collaborate once the government doesn't implement the National Action Plan. So I talk to some groups of government agencies, as well as the people who can propose these kind of things to the policy level, that it should not stay silent, stay like this for long, because the conflicts go on and on. So the third issue for my talk today is not only about women, peace, security, and about the policy implementation from state, non-state actors, but also how far the involvement and the reflect the effects of COVID-19 pandemic to women and to people in the society.
That's what
It is
I want
similar
to
to
ask
the
you. That's what I want to ask you to
so
conclude your presentation.
Yeah, yes,
Okay.
I will take about a few minutes.
Yeah.
So the COVID-19 impacts to not only people in conflict area, definitely, but to focus specifically in the conflict area where the implementation of women peace security is starting or initiating, is that women are victims in the beginning of the pandemic. Because the people who transmit the COVID-19, more or less the men, because men are more mobile. For example, the husband who participate with Tabligh Jamaat or the missionary movement, and then they were locked by the government, they were criticized by the society that they have to take care of themselves, otherwise people, especially family members, are going to be affected because they are the big group of people who can increase numbers of pandemic, the people who are affected by the pandemic. So within these kind of issues, we found out women, not only the victims, women are not only people affected by the pandemic, but they are the people who drive a lot and work hard, not only for the family. We know that working for the family, they work a lot during the conflict, but they also work more for the group of them, for the group of people in the society, for the organization. They work on behalf of organization, for example. They bring foods and deliver, share to different other places that they will lock very strictly. And they travel, they visit, they apply the theological framework, for example, Siyara, to the people who are in the difficulty situation. They apply the ideas of how we could live peacefully. So the ideas not only from Muslim ideology of theological interpretation, but also from Buddhist idea. The Buddhist theological frame is applied, whether they are segregated from certain during the conflict for certain elements, but there are the connecting persons, a group of people who try to merge with. With the NGOs, they work definitely again and again. With the state, there's a unit of health volunteer. Basically, the health volunteers are women. Again, the health volunteer are women, and they work with the state agencies, with the Ministry of Public Health, with the Ministry of Social Development and Human Security. This group of people work without pay. Definitely, they have the budget from the government, but they work voluntarily, and they have the online connection. In the beginning of the pandemic, people stopped to mobile, people stopped for gathering, but in certain times, people said that if we stop everything, and then how the society function, then it started by the government, but and also with the civil society. The civil society tried to connect with the government. During the pandemic, we also see that before the pandemic, the civil society worked more or less with NGOs, with international NGOs. But during pandemic, civil society worked a lot with the government sector, with state agency. So this scenario happening during the pandemic. And the rising of domestic violence is one of the issues that I like to highlight at the end of my talk. We do not have certain numbers of the statistic of people who are affected by domestic violence, but we have the group of people work in this regard, in this issue. We have the report, we have the research in this area. At least the qualitative research and the report imply that numbers of domestic violence are increasing because people stuck in their domestic sphere. But the way to report is difficult. We know that domestic violence is already difficult to speak out, to talk about, to report. And it's more when people stuck, but at least the group that function already in the community helps to support, psychological support. And sometimes when they are allowed to be gathered, they try to bring the issue to the people who have the bigger role. For example, the influencer from religious institution. So they report to the imam. Sometimes the imam could not cope because it's over than their duty and responsibility. They need to discuss with the committee of provincial level. It's solved in some certain case, but it's still on in different other cases. So this is the situation that I could share from Southern Thailand in particular. Thank you.
Thank you, Dr. Ampon. I think Dr. Ampon discussed about the diversity of women's happens in Thailand, in conflict area and then non-conflict area. They are the vulnerable as well, because now there is a transition of democracy that comes up with the young women, young people have started to questioning about the governments. I think there is a very interesting situation where Dr. Ampon actually told us about the shifting relationship between NGOs and the government before and during COVID. That is quite interesting, yeah, the shifting. And then also they are challenging in a way how to handle domestic violence during this pandemic, even though the case is still ongoing, and they still happen. I think, and then interesting that Dr. Ampon tried to make a link between a framework of the 1325 and then some issues that are very important with regard to the issues is related to the sexual violence, the participation of women, and then also the collaborations among actors in order to implement the NAP, National Action Plan. I think I will give space for the fourth speaker today, that is Madam Siti Rajabia S. Monato. So Madam Siti Rajabia Monato will give a speech on impact of COVID-19 pandemic on women and girls. Time is yours, Madam. And then again, I have to tell you that we need to have finished in 8 minutes. Thank you. Madam Siti?
Yes, good afternoon. Yes,
yes.
Can I share my slide?
Yes, please.
All right. Good afternoon. So I'll be talking about the impact of COVID-19 pandemic on women and girls. But before going into that, just to maybe I can mention some of the context also in Mindanao, particularly in the Bangsamoro Autonomous Region in Muslim Mindanao. So as regards the Women and Peace and Security for BARM, since we are undergoing the transition, we also have under the leadership of the Bangsamoro government, we also crafted our regional action plan on women, peace, and security for 2020 and 2022. So this is a first time for the government in the Bangsamoro region to have its own WPS. And this will be launched in the anniversary of 1325, where UNFPA is also supporting. The focus really on the WPS in ARM is on women and communities transitioning from conflict and the ongoing normalization and the prevalence of GBV in conflict affected areas. Okay, so for today's sharing, um, this is the outline of the presentation. I'll be talking about the gendered impacts of COVID-19 on women and girls. Uh, this is just the overview of the result of the gender inclusion assessment that we had, being led by the GBB subcluster at the national level and also here in BARM. And some of the mitigating risks that we're doing with our partners, and also the working group that we have within BARM, and linking it to our humanitarian development and peace building nexus. All right. So going straight to the result of the gender inclusion assessment. So we have 799 respondents in 6 national capital region cities, and then rural poor communities in Samar, Bicol, and also IDP camps in Batangas and Bangsamoro Autonomous Region in Muslim Mindanao, and then across 11 constituencies coordinated by 25 agencies. That includes nonviolent peace force as well. In addition, we have also covered 151 OFWs, people at risk of statelessness, and returning migrants were also interviewed. So these are the agencies, and including the women's rights organization, INGO, civil society organization, and 4 UN agencies. So just to show you the picture, some of the interviewees also relayed to the interviewer during the process that we can, given that Mindanao specifically, that we have the Marawi crisis, these are people already living in humanitarian situations, so we can't earn a living, which is, we find it hard to find food to eat. It was better during the Marawi siege when we could at least go out to find a way to earn money. So the restriction during the pandemic, and then also from women, female OFW, in terms of stigma and feared as carriers of disease. No? So locals are very afraid of migrants, especially when some OFWs were reported with COVID positive. No? And measures were stricter, and we have to observe social distancing. So as I said, BARM is already, there are areas in BARM that already in humanitarian situation, not to mention the Marawi siege. We also have in Maguindanao due to Rido or land conflict, and also the local ISIS-inspired groups already still existing in these areas that causes displacement. So leaving the farthest behind, more than 60% of the indigenous people and IDP and urban poor women don't have received enough support or assistance from the authorities, especially now that we are already in the 6 months of this condition. And then many respondents, especially elderly, IDP, urban poor, they receive support, but still it's insufficient, and considering the needs that that they cannot work outside. So they really need the sustained support from the duty bearers, from the government. So also these are stories from Mindanao, in Davao de Oro, in terms of giving support. There are also problem, no? The government chooses the people they will only extend assistance to, and not all are covered because they think that a family member is working abroad, they automatically exclude our family. So yeah, so that's one of the issues that our respondents also relayed to us. And in terms of women's resilience, coping, and the coping mechanism amidst the pandemic fears, There are also stories from women, that they are more in terms of coping. Women are more has superior skills, more creative, IT savvy, stronger discipline, and in terms of leadership skills, adapt to paperwork and can haggle or negotiate. So women have initiative and can provide and can respond more quickly. And most of the village leaders are women, particularly in this area. And then in BARM, women know more of right people to approach to than men, and also looking at the restriction on movement. Uh, Mostly men goes outside, but there are also women that also uh, find ways to make sure that they can feed their families. And then as to the sexual reproductive health and rights, pregnant and lactating women and LGBT worry about their access to SRHR and report significantly disrupted services. And then as a result, 2 out of 5 female respondents cannot access to contraceptives. 3 out of 10 female respondents report limited access to prenatal service delivery services, and 1 out of LGBT respondents cannot access HIV and AIDS services. So as you see, even before the pandemic, it's really challenging to access this kind of services, and now that we are in the pandemic, it become more challenging, especially for the survivors and those in need. Okay, so respondents report increased conflict and tensions within their households and willingness to report to GBV. So just to say that we are saying that GBV and this pandemic are interrelated pandemic, considering the measures that has been taken by the government, restrictions to movement. It would be difficult, especially for those women already living in the domestic violence situation. So the GBB service delivery and access points are severely affected by quarantine, especially during the period of March, April, and May, where we also documented cases of GBV, and access to services is really challenging. Movement is really challenging. There are checkpoints along the way, so you cannot just go there. Also, considering the confidentiality, etc. Abusers exploit quarantine conditions, and there are also reports that inside the quarantine facilities, women are also sexually abused. Survivors depend on trusted yet overwhelmed LGU. So these are just to show you the situation. And just to say that although there is a decrease in terms of number of cases reported and responded. This is from the Women and Children Protection Unit. Report is from the Child Protection Network. There is a decrease in terms of reporting, but it does not mean that GBV is not happening, because one, this is alarming because especially for minors and those victims of intimate partner violence who cannot access services to service providers, especially in the hospitals, because one is the priority is that the COVID patients, and also the accessibility of going from their communities going to the facilities. And in BARM, in the region, the Bangsamoro region, the GBV incidents during COVID, 38% of the female respondents said GBV frequency was higher compared to pre-COVID. And then you will also see women and IDP respondents are less likely to report GBV to the police. So we also noticed that in the Ministry of Social Services and Development and the Women and Children Protection Desk of the PNP, they don't have the same number in terms of cases of GBV and those provided services. because sometimes when survivors goes to the police, they are also being victimized again, no? So the stigma. And then you will see, this is the latest report in Maguindanao, the quarterly number of cases. The decrease really during the pandemic, the second and third quarter. So we have 97 cases, and like 80% of these are minors, and there are also minors perpetrators of this. So this is how severe the situation. And then if we're not gonna make any measures in terms of preventing and responding to GVB and ensuring services are available and accessible to the survivors, you will see a lot of cases, no, by the end of the year. And then in terms of mitigating risk, I just want to share with you what we do and what can we do in terms of mitigating GBB risk. And that you have online counseling, telephone counseling, everything is remote, but it's not automatic, especially in areas where you have a problem with internet connections, especially in our area in BARM. It's really difficult. So you have to have other options to make sure that that services are available and the awareness raising still continues. So we use radio, we use also the mobile messaging, using car and the megaphone, just to ensure that awareness raising and awareness about their rights, where can they access services, and also related to COVID-19 pandemic, really reach this community. So, in terms of risk communication. And then we also updated our GBB referral pathway to reflect any changes in service operation. So I just would like to show you that in ARM, in
Excuse
armed
me,
conflict in
Madam
Marawi.
Siti, I think the time is nearly up.
Yeah,
30
yeah.
seconds. Yeah.
Yeah. So just to show you an example, so these are the UNFPA's effort in terms of GBB risk mitigation and prevention, and linking it into humanitarian peace building development nexus. So we are also providing support to Bangsamoro transition and normalization, given that as we observe, there is this the normalization and the transition also very focused on the Bangsamoro Islamic Auxiliary, Bangsamoro Islamic Armed Forces, or the main forces of the MILF. So UNFPA look into how we can also support the auxiliary brigade, the Bangsamoro Islamic Women Auxiliary Brigade, who are former combatants, but now already some of them were already decommissioned. So capacity development of BWAB members as service providers, and they transformed into parasocial workers and social welfare aid and GBB watch group, and they do this information dissemination and GBB prevention and response, and then also they can be the community-based pregnancy tracking, some of the activities and maternal death surveillance and review, and also the cash for protection that could also address the mental health issues, and also the GBB survivors, and cash for help, especially those providing care work, no, women providing care work, and then RH equipment and supplies. Yeah, I think I'm okay.
Yes. Thank you, Miss Madam Siti. I think I hope that every country have updated data like this, yeah, in order to COVID. It's very clear about, and that it's very it's covered variety of the women's, the migrants women, the poor urban poor women, elderly, LGBT, even the pregnancy women. I hope that every province have updating data like this, and I hope that also this kind of material can be accessible for for any participant in this particular discussion, because it's very interesting one. Yeah. So again, the issue of access to services during the COVID, especially for those who have experienced domestic violence, still problematic. It is also found in stories told by other speakers as well. So, and then some program are very interested, and then we will look at forward to discuss about it through the discussion process. And before I give this opportunity to the last speaker, participant, feel free to write your question in chat, because I don't think that we will have a longer discussion session. So I think it's better for you guys to write down on the chat. So after the last speaker, we will read your questions, and then I will ask other speaker to respond on the questions. Okay. So the last speakers today is actually Madam Vanessa Fianza Palarco. Yeah, Madam, it is interesting. My question is whether the initiative have been done in your country is related to what Ibu Siti Rajabia mentioned before, related to the framework on the COVID-19 response, and then related also with the framework of National Action Plan. So I hope that you can share with us. Time is yours.
Good afternoon, everyone. Can you hear me?
Yes, Madam, clearly.
Yes, hi. And I'm seeing familiar faces online, especially Professor Miriam Coronel. And she's really the woman who has laid the foundation to what we are doing right now, especially in the Bangsamoro peace process. Okay, so kindly allow me to share my screen.
Please, yeah.
Yes, may I request the person in charge to please allow me to share my screen. Thank you. Okay, so can everybody see my screen?
Yes, yep, clearly.
Okay, so in as much as Secretary Carlito Galvez Jr. would want to participate in today's forum, unfortunately, due to his other assignment as the chief implementer of the National Task Force Against COVID-19, along with his designation as the presidential advisor on the peace process, it's a bit difficult to secure a time for his availability. Nonetheless, he is actually extending his congratulations to the Nonviolent Peace Force, and also for the colleagues who are here right now, the AIPR representatives, and also our stakeholders in the peace process. Okay, so I think for today, I'll be sharing with you some of the experience and updates on what we are doing in OPAP. So we continue to do our peace building initiatives, particularly in this time of COVID-19 pandemic, along with our additional designation as part of the National Task Force Against COVID-19. So I'll be dividing my intervention into two parts: a quick update on what we are doing, and also a quick update on the National Action Plan Against COVID-19. So I'll be sharing that to you as well. Okay. So currently, we have the National Action Plan on Women, Peace, and Security, and this is anchored on the different international and regional agreements for us. So we have the IHL, the CEDAW, the UNSCR 1325, 1820, and related resolutions, the BPFA, and also the SDGs. And to concretize these commitments, the Philippines has developed its National Action Plan on Women, Peace, and Security. So alongside with that, we remain committed to, as a member of the ASEAN, we continue to advocate this women, peace, and security. So in fact, in 2017, during the chairmanship of the Philippines, we were able to come up with a joint statement on promoting women, peace, and security in ASEAN. And also in 2019, we had a joint statement on promoting the Women, Peace, and Security Agenda at this ASEAN Regional Forum. And I'm happy to inform you that we also, Philippines has also been instrumental in the development of the ASEAN Women Peace Registry. That's part of the ASEAN Institute of for Peace and Reconciliation. So at the national level, we were able to come up with this different legal instruments, such as the Magna Carta on Women. We also have the Executive Order 865 in 2010, and this also incorporates the Philippine Development Plan also incorporates our agenda on women, peace, and security. And I think my colleague from has also shared to you earlier about the BARM Regional Action Plan on Women, Peace, and Security. So these are just some of the, because we have localized the National Action Plan, and BARM is the priority area that has made its own regional action plan. So just to show to you, these are some of the legal instruments that are that we have also used as basis in the development of the National Action Plan. Okay, so I think most of you are already familiar with UNSCR 1325. So I'll be skipping this one, and we'll, if I have more time, we can go back here. Currently, the Philippine Development Plan also reflects the National Action Plan on Women, Peace, and Security. So we want to ensure that all the development interventions are reflective of our WPS agenda. So currently, OPAP serves as the chair of the National Steering Committee, and we have the different agencies that are supporting the implementation of the National Action Plan on Women, Peace, and Security. So these are also the different instruments that we use in order to ensure that the women, peace, and security is reflected in the different policies at the local level. So particularly is the Gad Plan Budget. So we have the policy wherein you can use at least 5% of the agency budget towards gender and development. So for our National Action Plan on Women, Peace, and Security, it is now currently at the 3rd generation. So the first generation was civil society led, and it's a collaboration between the civil society and the government. Meanwhile, the 2nd generation is a government led, and still it is a collaboration of all the relevant stakeholders. Of course, we want to ensure that all the stakeholders have been consulted in this particular development. So these are the pillars where we anchor the National Action Plan. So the first one is that the women and girls through meaningful participation and leadership are active change agents in conflict transformation and post-conflict development. So for the next substantive pillar, we have the human rights of women and girls being protected at all times. So this includes the before, during, and after various conflict situations. For support pillar number 3 and 4, we have the gender perspective being mainstreamed in all initiatives geared toward conflict prevention and resolution, as well as peace building and conflict transformation. And for the 4th one, we have the ensuring of the accountability in implementing WPS interventions through the development of a comprehensive system to document, monitor, and evaluate and report the implementation of the National Action Plan on Women, Peace, and Security using evidence-informed tools and enabling mechanisms. So all of these are aimed at contributing to the expansion of women's role in the peace process and conflict transformation and to the protection of their human rights in conflict situations. So just to give you a quick update on what we are doing as of the moment in the implementation of the National Action Plan. So currently, as I mentioned earlier, we have the mechanism, an interagency mechanism that helps us in doing the implementation. So we have the agency-specific action plans, and currently that's what the NSC or the OPAP monitors. So each agency, such as the Department of Foreign Affairs, Department of Social Welfare and Development, they have developed their own strategic action plans that incorporates women, peace, and security in their different PPAs. So recently, with the light of the COVID-19 pandemic, some of these PPAs had been revisited, and integration of COVID-19 relevant initiatives have been part of the annual Gad Plan and Budget of the different agencies. So alongside with that, we have continuous implementation of the NAP-WPS interventions. And of course, that is with observance of the minimum health standards. And this includes the wearing of face masks, proper hand washing, and strict observance of the person's hygiene. So currently, we are also encountering challenges on how to go about by our identified activities and projects, especially in case of OPAP, which is about, which largely a lot of our activities involve social healing and peace building interventions. And a lot of this involves community dialogue, social cohesion, strengthening. And it's quite a challenge for us because at the moment, we cannot convene a huge number of people. And since we want to, like a lot of the context, for example, in Marawi, we want to contribute in the rebuilding of relationships among people. It's actually challenging to do that right now because we cannot really gather a huge number of people, and at the same time we have to observe the social distancing whenever we do the activity. And more than that, one of the challenges is our travel is also limited. So,
excuse me, madam, I have 1 more minute to conclude.
Okay. So we continue to have our dialogues in the different conflict-affected areas. But let me just give you a quick idea, because we also have the National Action Plan against COVID-19. And part of this is an intent to ensure that the vulnerable sectors, especially the elder women and the younger girls, are protected, since as part of the health security, they are the ones that are more susceptible to this disease. So I just want to share with you that we have incorporated this in the National Action Plan against COVID-19, gender and culture-sensitive human development interventions, and social healing and reconciliation in the implementation of different policies and programs. So these are the different challenges that we face in peace building with respect to COVID-19. So we have encountered some delays in the implementation of the different deliverables because some of the agencies also had to do a lockdown and measures whenever there are cases identified in their building, in their respective agencies. Delivery of services become a bit challenging as well. And of course, the accessibility of technology in conflict-affected areas. So in our case, we are quite fortunate we are able to use the internet, the computers, but in conflict-affected areas that do not have access to this basic, to this technology and devices, it's also very challenging. And some of our partner agencies have also shifted their priorities to COVID response. But at the end of the day, of course, we do not lose hope because there is still a lot that women can do. And us as OPAP, we still try to do our best to ensure that the women's peace and security is still being addressed. So in some of our focus group discussions, these are some of the suggestions that emanated. For example, on what women can do in this situation. So currently, since a lot of the households have the mothers and sisters, we would want to have them as strong advocates of minimum health standards. So minimum health standards includes the wearing of face masks, the proper hygiene, because even though we are at home, it doesn't mean that we are safe. Still, the threat of the virus is there. And of course, we still continue to be champions of peace building advocacy using available platforms. So currently, we are still doing a lot of peace conversations online. We try to maximize the social media, but in some cases when there is no available technology, the radio sometimes become a viable tool.
Thank you, madam.
Okay, so I'll just be concluding with that.
Okay.
But I do hope to share with you more during the open forum should we have time. Thank you.
Thank you very much. I think it's a very interesting, discussions today, because we start from the local issues in Papua and then in Sabah, and then we move to discuss about the framework of National Action Plan, and then we discuss about the program interventions in the some national and regional level, and then with Madam Vanessa. It's very interesting not only to talk about the COVID, how to make a link COVID-19 as a challenge in order to implement National Action Plan. And then there's also information that in Philippines, there's not only National Action Plan, but there are already 3 phases in a way how to implement that. And then there are complete guidelines in order to implement the National Action Plan in a local level. So I think it's very interesting framework. Then I found that several issues that has been come up during the session. The challenge during the COVID, it does not mean that violence against women stop, but it still continue. But the problem are there in order to handle the limitations of mobility, and then the delay of the delay of the services because of the COVID, and then there are the problem of women in Papua. They become disobedient because they have to survive in order to income and earning the money for the family. So this kind of situation are very kind of layers that we have to face. And then luckily that what Dr. Apon before said that, but women actually in the core of the movement. They are starting from individual movement. They start off from their family. They do initiative in different way, and then it's quite interesting in the way how women still there become the agents, and also they do coping mechanism sometimes, but they are not stopping. They are struggling to face the COVID for their family and for their community. So there's some issues that comes up during the session, and now I open the session for discussion. So I might only can invite two participants who wants to give some comment or question. Is there any? There is no comment from the participant yet. So, and I also see there is no chat in chat book. So I think for 10 minutes discussion, I will invite every speakers, but please only in 2 minutes to respond. Who wants to respond other speakers? So I invite 2 speakers that wants to comment other presentation. Is there any? There is no comment from other speakers to add more information from other speaker. Dr. Ampon, do you want to say something?
Yes, there
yes,
is. There are personal message sent to me. Actually, there are numbers of sharing or asking for sharing the information. I know that people are trying to understand the situation in different areas.
Yeah.
And from this discussion, and not only the forum that we discussed today, but different others could be developed as the sharing information to the public. The knowledge is public, right? And then
Yeah.
we already discussed, we share, and people could take some kind of experience and reflect to what we have done.
Yeah.
And reflect not only to the speaker, but reflect to what the speaker said, or elaborate about their own society. So this is just the clearance, or the further task that we can work more or share with the society.
Yeah, I think that's very important point of view, Dr. Ampon, because we find out during this session, we actually discussed a lot of different contexts. Yeah. So but we can find they are more focused on a community, which it is very interesting, because if we look at to the national action plan in national level, and then we look at to the 1325, it is very far away. So very far away sometimes from the local level. But today's discussion, some speaker actually tried to make link and then make clear that even though it is in international level, especially Dr. Ampon was discussing before, but there are the implication of this international level to national level, and then there are implications to the community through the program, established in a national and international community that directly help women in community. So that's a very interesting story, because some studies are showing up that at least there is no impact of the National Action Plan and the international VPS to the local level. Even in Indonesians sharing session that I attend in many discussions, it is a lot of questions about why we still have this, and then we need to reflect it, and then we need to make it clearly that this platform is actually linked to the community. So that's very important. And then with regard to the COVID issues, so I think every speakers mentions about there is a challenge that they face, or the women face in COVID. So it is well known, yeah. But some of us discuss about the tendency in some country, the violence against women might raise, but in the other country might not be reported. And because of the mechanism in responded become problematic during the COVID. And then there are, hopefully there are women become a center of the, facing the COVID in community and in the family. But the other issues that's not coming from this discussion, but the other discussion mentioned about how does in the same time women as an agent, but in the same time it's actually become a burden of women. So this is a kind of problematic issues, and this is kind of again the platform that we need to build up. And then I think we need to move forward not only about women's issues, how to make a coordination a collaboration that mentioned by Ibu Winnie to others stakeholders, male and female, that are related to the issues of the conflict and COVID particularly. So, okay, I want to conclude it, but actually there is one participant come to ask the question. So please, before we so there is Anchana. Anchana asked us about harassment attack happened to women during karantina by security officer in certain malls of Thailand. So what the protections implementation should be, and in terms of the conflict, how women can protect herself. So I think this question is for Dr. Ampon.
Yes, thank you. Actually, Kun Anchana is the one who worked hard in the area of conflict, and she worked collaboratively with different other organizations and civil society organizations. From the perspective that I could share with, there is no certain kind of mechanism from the state agencies. Definitely there are laws. The legal systems provide that kind of protection. But in practice or in actual action, the community still need to protect ourselves. And once women are in the situation of being harassed or being violated, the mechanism of the society is important. We know that some women could not be able to do the report, especially during the quarantine. Get back to what I have said about the norms and the structure of the society, that we need a collaboration when 1325 focus specifically on the collaboration between amongst different sectors. So we need to question back to the state agency, which is the main sector who need to protect their own citizen according to the constitutional law, according to the legal system, as we are the citizen. But once this kind of mechanism doesn't function, what else we could do? Why we are unprotected? Why we are harassed? So we still have to do some more actions. For example, there are certain groups of people and young people have the campaign, move on the street, but sometimes they also have online statement to provoke what they could not stand anymore. That's a implementation that can be applied, that women already work with, some of them work silently behind the curtain because there are difficult bureaucratic system and hierarchical layers that they have to achieve before they get passed to that kind of system or law. So I still cannot provide a certain answer, but I still insist that the collaboration is needed. And we still need to work. And I'm happy that our friends and sisters come to join with the forum. And we look forward to work with the government more. Not only with the government in the sense of getting the policy and bring it to our life, but listen to the citizens, listen to the civil society members, and what kind of level that we could walk together. So this is one of the most important idea that I could share with, and I think there are some other speakers could share with if you have similarities of the situation that you can contribute it.
Yeah, thank you, Dr. Ampon. I think it's very important to highlight, because if we look at to the one of the important framework of women, peace and security is actually to voice the unheard of women, to make it visible of the voice of women in every layers, particularly in the way how to develop a policy and to mechanism, and also to monitor whether the mechanism is implemented. I think because time is nearly up, it's already up, I think we can continue our discussion today, but we still can continue our discussion because this is the first forum session. There would be another session, the second, the third, and the fourth, and I hope that we can continue our constructive discussion through attending for a session organized by the organizer today. Yeah. So before we end the session, I hope that we can take a picture together. Would you mind, everybody, the participant can show up the camera, and then we will take a picture together. So I can remember Ibu Winnie, I can remember Ibu others, Ibu Dr. Apon, yeah. So are the organizer ready to take a picture of all of us?
Yes, we're just waiting for others to show their
okay.
video. Let's see on the second. So stand by. Stand by.
Okay.
Stand by. 1, 2, 3. Wait a minute. Okay, 1, 2. One more time. 1, 2. Thank you very much. Maraming salamat.
Salamat po. And then Assalamualaikum. Alhamdulillah.
Assalamualaikum. Terima kasih banyak.
And then
Terima
God bless
kasih.
us.
Hi, si
and
Ma'am
stay
Memen.
healthy.
Thank you.
Bye, Ma'am
everyone.
Winnie.
Bye.
Bye. Bye, Richelle. Bye,
Bye, Ibu Winnie.
Ma'am Mersha. Bye-bye.
Hi, Ma'am Memen. Ma'am Memen.
Yeah. Bye, everyone.
Bye, Ma'am Memen.
Bye.
Nandun na yung
Bye, Dayang.
Bye-bye.
Hello, Dayang.
Hello.
Thank
Bye-bye.
you. Thank you, everyone.
Nice meeting you.
Nice to
Thank
meet
you, everyone.
Bye.
Hi, Ma'am.
Bye.
Bye.